Afternoon, everyone. We do apologize for the delay. My name is Gina Ford. I am the Communications Director for Prince George's County Executive Angela Also Brooks. As you are aware by now, we were notified last night about our fourth positive COVID-19 case. And so today, the County Executive, Dr. Carter, are here to bring the latest details. So first, you'll hear from County Executive Also Brooks, followed by the Prince George's County Health Officer, Dr. Ernest Carter, and then Dr. Monica Goldson, the CEO of the Prince George's County Public School System.
Good afternoon, everyone. Thank you all so much for joining us today as we share some very important updates with our community. I first want to begin by thanking all in county government who have worked tirelessly to make sure that we do everything we can to preserve the health and safety of Prince Georgians. I also want to thank Prince Georgians themselves for their patience, who since yesterday have had to wait for us as we gathered to be able to provide the most accurate and up-to-date information possible to our community. I want to acknowledge those who are standing with me this morning. I first want to thank Dr. Carter, who is our Chief Health Officer, who you will hear from in just a moment. I am also joined by County Council Vice Chair Calvin Hawkins. I want to thank him and the rest of the council for their support. Dr. Monica Goldson, who is our CEO of our Prince George's County Public Schools, is here, and she will address you. Ronnie Gill, Director of our Office of Emergency Management, and they have been working around the clock, as well as Fire Chief Tiffany Green, who is here this afternoon. Late yesterday evening, we were notified by the Maryland Department of Health that a resident of Prince George's County tested positive for COVID-19. This is the fourth confirmed case for our county. The individual is a man in his 60s who is currently hospitalized. I would like to ask that all of us together continue to keep him, his family, and everyone impacted by this virus in their prayers at this time. Our county health department is working with the state of Maryland to conduct that investigation, and we will provide updates to our community as we have it with more information. In reference to this latest case, I can tell you that there are also potentially 12 firefighters who could have been exposed to COVID-19. The department is following its policies and procedures regarding self-evaluation of those firefighters, and we will continue to monitor their conditions. In addition, as many of you know, Prince George's County Public Schools was notified yesterday that an individual affiliated with Eleanor Roosevelt High School and College Park Academy had close contact with someone who traveled to a country under a high-risk coronavirus warning. And as a precaution, both schools are closed today, March 12th, and tomorrow, March 13th, for cleaning and sanitizing. Students and staff will return Monday, March 16th. You will hear from Dr. Goldson in a moment, but what I should say, especially to all of our parents and students, is that we will, in every instance, make a decision that we believe is in the best interest of all of our students and staff, and that their health and safety is our first priority, and that we will be making decisions that are out of an abundance of caution in every instance. Our health department is conducting an investigation and gathering important information from the individual relating to the school, and we will keep the public informed about that. There will be a telephone town hall tonight, and Dr. Goldson will provide further updates about that town hall. As we saw yesterday, COVID-19 is becoming a bigger and bigger issue. The World Health Organization officially declared this virus a worldwide pandemic, recognizing how quickly it has spread across the world. Even more, last night, the NBA officially suspended their season, recognizing the potential impact and spread of this virus in large crowds and confined spaces such as a stadium. The good part for all of us is that everyone can do their part to contain this virus. The easiest thing to do is to take several easy everyday actions, such as washing your hands with soap and water for 20 seconds. We're asking people to please cover your coughs and sneezes with a tissue or arm. And I'll let Dr. Carter discuss this in more detail, but there are prevention methods, and the one that we are really stressing today is social distancing. This is really important that we practice social distancing, and Dr. Carter will talk more about what that means. I especially want to stress that these recommendations are especially critical for particular parts of our community. According to the Centers for Disease Control and Prevention, some of our residents are more at risk of potentially contacting COVID-19, such as our seniors and those who suffer from chronic medical conditions. Those medical conditions include lung and heart disease, as well as kidney disease, and we advise those individuals to please take extra precautions. This means that if you do not have to go out in public, especially large crowds, to please avoid it. We're asking that you also avoid contact with those who are sick and that you wash your hands often. Also, to have access to several weeks of medications and supplies. There are also some quick things that you can do to plan ahead in case you become sick, including please stay in touch with others, develop a contact list of friends, family, and neighbors. And if you have a caregiver, determine who can provide care if your caregiver gets sick. And also, always listen to your body. If you are sick, call your health provider and discuss your symptoms. As a community, we must come together at this time, most especially to look out for our seniors and others who are at risk to ensure their safety and health. I can't say it enough that our seniors truly are at risk in this. And so we're asking all Prince Georgians to follow some actions to support and take care of our seniors. Let's just make sure that during this time we are taking care of each other. Please reach out if you are able to check on our seniors to make sure that they are okay. Consider for some of them who now will feel uncomfortable and who, quite honestly, will be advised against places with large volumes of people, such as the grocery store. It may be a good thing to check on those seniors to see whether you might be able to bring to them some of the groceries or medications or other supplies that they need in order to reduce their time in public. And if you have a loved one in a care facility, monitor the situation and call in to check on them in the facility rather than visiting in person. So this is a rapidly evolving situation. It is very important that every Prince Georgian stay informed. We will continue to provide you updates, but you can do this in a number of ways. Call our hotline at 301-883-6627. You may also visit our website at health.mypgc.us/coronavirus. You may also follow us on social media at CEX Also Brooks. And we have a few other updates about these resources. First, our coronavirus hotline will now be open for extended hours, including on the weekends, from 8 a.m. to 8 p.m. daily. We are actually, but you can always call the hotline, but we're actually the first coronavirus center in the state to open on weekends. We are going to continue to do that as the need arises. In addition, I want to let the public know that we have unfortunately learned that there are a number of fake websites floating around on the internet to try to scam our residents. And so we want people to be vigilant about that as well and to be very careful about the messages that you get on social media. That's why it's important to really stick to, as closely as possible, websites like the one that the government posts, or call our hotline to ensure that the information you're getting is accurate and credible, and to protect the safety of yourself and your loved ones. We've been printing fact sheets and other information to distribute, and we'll be mailing it out as well. But we want to recommend that our residents please only call 911 for emergencies. Please preserve that. We're getting really inundated there. But for general questions or concerns about the coronavirus, you can call our hotline, which again is 301-883-6627. And we want you to know, above all, that we care, that the county government is here. We're working to ensure that every Prince Georgian is healthy and safe. And that we will take appropriate steps at all times to provide to you the latest updates that you need so that you are aware of what is happening in the county. Working together, if we all do our part, we really do believe that we can help to prevent the spread of this virus and contain it. And we thank all of you again for staying tuned and for doing your part to make sure that we contain this virus, that we stop it and that we protect those in our community who are most vulnerable, most especially, I'll say it and keep saying it, please, our seniors and those who suffer from chronic medical conditions. Let's make sure that we're reaching out to them and doing what we can to help. So at this point, I will turn over the microphone to Dr. Carter, who is the Chief Health Officer for our county. Thank you.
Thank you. Good afternoon, everyone. The coronavirus, COVID-19, is in our community. So we need to team up now. We need to make difficult but necessary adjustments to our lives and our activities. Our county government, residents, businesses, and other critical partners across Prince George's County must work together to defeat this disease, COVID-19. So far, COVID-19 has shown to be very resilient. The virus has rapidly made its way into the United States, but more importantly, it is shown to be a deadly virus. The latest data shows that the coronavirus mortality rate is about 15% for people who are 80 or older. I'll say that again. The latest data has shown that the coronavirus mortality rate is about 15%, meaning 15 out of every 100 people who are over 80 who get the coronavirus, it gets to them. We're also discovering people who are 60 or older, as well as people who have severe chronic medical conditions, are more likely to be very sick from coronavirus. As we continue to learn more about the virus, this remains an evolving situation. Our public health experts across Prince George's County and the world are working overtime to get more answers about the coronavirus. Those answers will continue to give us the best guidance for how we can win the battle. But we can't do this alone. We need to come together as a county to do our part to keep ourselves and our neighbors healthy and informed. The CDC recommends people minimize close contact and avoid crowds. You have to use your best judgment when it comes to modifying activities and events. If this means canceling or postponing your event, so be it. We must protect the health and well-being of our communities. That's where the major adjustments in our life begins. You'll be hearing a lot about social distancing. This means limiting your participation and the distance you keep between folks when you're in a gathering. When out in public, try to maintain a distance of 6 feet or more from others, whenever possible. Avoid shaking hands and hugging. You know, Prince George's, we love to hug. I know that's tough for us to do, but that's an important moment. Social distancing will help us slow down the spread of the disease. Right now, we're anticipating an increase in cases in the county and the state. To reduce the spread, we must reduce the number of people who get exposed to coronavirus. Remember, coronavirus spreads person to person. That happens when somebody within 6 feet of you coughs or sneezes and dispenses the respiratory droplets in the air. These droplets can land in your mouth or your nose of other people, or probably get inhaled into your lungs. As we speak, the health department's experienced and dedicated infectious disease control experts are working extremely hard to gather all the important information from our confirmed coronavirus patients and the people that they've been in contact and around lately. That means right now we're gathering information and we're trying to determine what the risk exposure is in our county. We are monitoring the situation and we're receiving every update from the state and the CDC, and we're communicating with our counties that are around us. One thing I have to emphasize, we must continue to practice excellent and consistent personal hygiene. What is that? Washing your hands, often with soap and water, at least 20 seconds. If you don't have soap and water, use a hand sanitizer. If you don't have a hand sanitizer, at least have a solution of 60% alcohol when you're washing your hands. Cover your coughs and sneezes. Try to keep your hand out of your face, which is very difficult for me, but I'm doing it. Avoid close contact with people who are sick. If you're sick, stay home except to get medical care. It takes anywhere from 2 to 14 days to start feeling symptoms after exposure. These symptoms are fever of 100.4 or higher, cough, and difficulty breathing. If you develop these symptoms, and if you have concerns, you have been in close contact with a person known to have COVID-19, contact a medical provider. Please stay up to date with us through our website and social media accounts. Look out for each other. Really look out for each other. Yes, COVID-19 is resilient, so are we, as long as we take care of ourselves and each other. I'd like to thank you. And at this time, I was going to hand it back over to Dr. Golson. Sorry, Dr. Golson.
Thank you. Good afternoon. On yesterday, I made a decision to close Eleanor Roosevelt High School and College Park Academy for today and tomorrow so that we could sanitize and deep clean those two facilities. It was brought to my attention that an individual affiliated with those two schools had close contact with someone who traveled to a country under a high COVID-19 warning. And so I made a decision as a precaution to make sure that those two facilities are cleaned. That does not mean that that person affiliated with those two schools had tested positive. In our effort to make sure that we also practice social distancing, we have updated some of our practices and made changes. Before I share those things, I want to share that on our main webpage, we have updated information about COVID-19, so please feel free to check our website, which is updated daily. We have asked parents to make sure that they check their SchoolMax online module to make sure that their contact information is updated, as well as their emergency contact information that's located in schools. We have initiated scheduled hand washing at the elementary level every day, and a constant reminder to our secondary students to frequently wash their hands. We have relaxed our attendance policy for students who are sick. We ask the parents to please keep them home and no need to get a doctor's note. Ask that they please just create a note when they return from their illness so that we can contact them. We have canceled the following: no international travel or out-of-state travel. We are canceling international teacher exchange programs. Out-of-state and local overnight trips are canceled. Out-of-state and local conference attendance has been canceled. And out-of-state field trips, including Virginia and the District of Columbia, effective tomorrow, will be canceled. We will continue to monitor field trips within the state of Maryland on a daily basis. As stated earlier, I will be hosting a teletown hall tonight from 6:30 to 7:30 p.m. Parents and employees will receive a phone call at 6:30. So to join the call, they simply just have to answer the call and follow the prompts. And if you are not a parent or an employee and you'd like to join in, please visit our webpage so that you can get very specific call-in number so that you too can join the teletown hall. We will have a specific line to support our Spanish speakers as well. As stated earlier, I will continue to monitor our situation daily. I am a parent and an employee and a leader of this school district and always look at every factor involved with our 136,000 students and 22,000 employees. And we'll continue to make decisions to make sure that our staff and our students remain safe. Thank you.
All right, with that, we'll take any questions.
At this current time, there's no evidence that this particular person traveled. So this is more than less likely, and of course we're still in the investigation stage. But it seems like this is probably a community-acquired
Best way to
disease.
report it is under investigation, possible community spread.
That's right.
Could you talk to us, please, about the protocols now with the first responders who may or may not have had some sort of contact. What is that protocol all about?
Yeah.
Thank you.
Green.
Thank you.
Okay, so let me first say this. Prince George's County Fire and EMS Department is ready to handle this incident. We leaned forward in January to make sure that our policies and procedures were in place. We ensured that we had the PPE or personal protective equipment necessary for our firefighters to be able to run these calls and to be able to be successful. The policies and procedures that we're following are our normal infectious control policies and procedures. We are working with the health department to make sure that we're investigating the entire incident. All 12 of the firefighters have been contacted and at this time are being self-evaluated. If for whatever reason they experience any signs and symptoms that is directly related to COVID-19, they'll follow their normal procedures of notifying the health department, and at that time we'll evaluate it.
Are they working?
At this time, all 12 firefighters are at home and they are self-quarantined.
So there are, just a question, because firefighters live in such close quarters, a lot of them staying together. Are there any concerns about the fire?
At this time, it's still being investigated. It's an active investigation and it's changing daily, but we're working with the health department to evaluate that. And if at any point we decide that we need to expand it, we will.
Firefighters in contact with this fourth individual?
I'm sorry, repeat the
Were those
question.
firefighters in contact with the fourth individual? Is that why they were dealing with that?
Yeah, so there were 3 potential contacts. And at this point, the investigation did reveal that we did have some firefighters that were potentially exposed to the positive COVID-19 patient.
So they responded to this today?
That's correct.
Dr. Carter, if you could, if you're able to explain a little bit the process for residents who may have a little bit of fear, what is the procedure of people being checked?
Well, if they have symptoms, and that's cough, or if they have a fever of over 100, 100.4, or if they have shortness of breath, they should contact their physician. Their physician. And they can notify us, but it's their physician who has to make the determination of whether or not they should be tested.
And so how's that test done?
How's it? They take you, they send you to the lab, you get tested, like any other test.
Is it a swab?
Yes,
Okay.
there's a swab. Yeah, I'm sorry.
No,
Yeah.
that's fine. Thank you.
No, I'm sorry. Yeah, it's very simple.
Once that test is done, once the test is done, how long does it take the results to come back?
I'll tell you, it varies. That's number one. It can be 24 hours. It can be up to 72 hours. You can imagine that the state labs are getting a lot of tests right now. So it varies depending on, the rate that they can turn around. But for the most part, they turn it around in about 48 to 72 hours.
Go ahead, Scott.
Doc, I'll ask 2 questions. So
Yes, sir.
have my colleagues here have a chance. First of all, can you describe the condition of the individual, good, fair, serious, whatever, if that's possible? And the second thing is, on this testing issue as a local official, is the testing providing you the data you need to determine whether or not community spread is occurring?
Well, the data from the test?
Yes, sir.
Well, no, actually, the investigation will tell us about whether it's community spread or not.
All right, so
Okay, that's one. And the other one you asked me was,
can you characterize the condition of the individual who's been diagnosed, please?
I can't because I honestly right now haven't seen the medical record. I know it's serious. It's not, but I don't know whether he's getting better and better, or whether he's getting worse and worse. That's under investigation at this time.
Can we use the term serious condition?
I
Is that accurate?
wouldn't. I wouldn't use it at this time because not until I get confirmation from the medical facility, and we didn't. What we came to find out was that he was hospitalized, and that this is a individual who we have to, because he is a senior, we have to take a really close look at. So when they let us know, we'll let you know.
Okay. Dr. Dawson, youth sports, sporting events, youth sports that are school-related, leagues, all that kind of stuff. What's going on in the school system right now with that?
Thank you for that question. We actually are now reviewing our athletic and performance events for our students. What I can tell you as the Maryland State Department of Education, we're in the process of playoffs at this time, and those will be closed athletic events that will be housed at the University of Maryland in Towson today through Saturday. Only those athletes and their parents will be able to attend. And based on that information, we'll be in consultation with the county government to determine our next steps. My goal is to be able to give our community information related to that by this evening's teletown hall or tomorrow morning.
Brad?
If the Prince George's County school system did close, what would that process look like? How would you all arrive at that decision? And what would it look like after? Would it be online courses? Would it be paperwork sent home, packets? What would that look like?
Yes, that seems to be the most common question that we receive is what would happen. And in our case, really honest and truly, we'd have to have a more heightened number of cases where we honest and truly thought that we needed to seclude our students and our staff in a location to help to reduce the exposure rate. We're not at that point at this time. We are in constant conversation with our community partners, meaning our health department, our county executive daily, and my team meets every evening so that we can assess every situation that's brought to our attention. But in the event that we have to close for approximately 2 weeks, and I say 2 weeks because that is the amount of time that we have been told could potentially lead to exposure, self-quarantine time, our staff will provide instructional packets for our students to receive at home, but we will not be implementing remote learning. And the reason for that is because I have 82,000 students who are on free and reduced meals, and I cannot guarantee that every child has technology and has access to the internet in order to continue that instructional program. We have received direction from Maryland State Department of Education. In the event that that does have to happen, then we will have to be in the position to make that time up, either extending the school day upon our return or extending the school year.
Dr. Phillips, on the same subject, and that's the question we're all getting, what about the schools? We've seen other counties close for a period of time, the entire system. Yesterday, University of Maryland and all the schools, I talked to the director, the dean of school of public health, and he said schools just don't allow for social distancing. So without a case, the campus closed. Can you sort of elaborate on, why do you feel it's so important to keep these schools open in this community?
Well, first, let me say the distinction between universities and the public school system. Our universities have many students who come from across the nation, not only the United States, but several countries. And I understand their heightened need and concern and empathize with their need to want to make sure that they keep those students safe. I also know the communities that my children come from and where they live and reside. And as I stated earlier, I have 60% of my population who's on free and reduced meals. So we're in constant conversation with the Capital Areas Food Bank to make sure that in the event that I do have to close, I want to make sure that those students and families still are being fed. We provide breakfast, lunch, and dinner in many of our schools. And so for me to automatically, quickly to make that decision does not allow parents an ample time to make sure that they get the supplies that they need so that they can continue to protect that child at home. And lastly, just want to reiterate what our Dr. Carter has stated. The population that is most prone are our seniors. I have the opportunity to serve 136,000 students, and though 8,000 of them are seniors, they're seniors in high school. They are not senior citizens. And so it is my goal to continue to protect them and the seniors and my teachers who serve them. And at this point, we have no indication from our health department, our county executive, and other agencies that we're at a point that we need to close the school system completely.
Okay, thank you, everybody.
I'm sorry, I have one more question for whomever. We were talking about Sunday services. There are churches in Prince George's County with thousands of members who all had press or calls, conference calls with pastors. What is the message for churches?
So we just finished, we concluded a conference call that we actually had with over 100 pastors this morning. And Dr. Carter was on that call, and he said some very important things, that we are, first of all, in a different phase. I think that's important to take away from this particular press conference, is that we are in a different phase in terms of the transmission of this virus. And the reason that we believe that is because the fourth case here is distinguishable from the first three. The first three cases that were positive in our county are individuals who we could trace travel outside the region, outside the country. The fourth case is a different case. It's different because we cannot, as far as we know, trace travel. This is a gentleman who, for the most part, stayed home, did not travel a lot, and so we're concerned. We cannot trace at this moment like we could with the first three. And so this means that we are in a different state. And so what we said to our pastors, and I will allow Dr. Carter, if he'd like to elaborate on this, is that we have to take extreme precaution at this point. We are advising, especially for our older residents and for those with chronic medical conditions, that we advise that those individuals take precaution, including remaining out of large crowds. We believe that it is risky and extremely dangerous to do that, and so we are advising, especially our residents who are older or who suffer from those chronic medical conditions, lung conditions, heart disease, kidney disease, that it is inadvisable and dangerous to be in large crowds. That is the guidance that I have gotten from our chief health officer, from the Centers on Disease Control, who give this guidance right now. And like I said, we believe we moved from one phase to the next where it was important for us to give this information now, given that the fourth transmission was one that was very different from the first three, where we could chart travel or something else, and this one is a little different. So Dr. Carter, if you would like to.
I agree with everything the county executive just said. I think that this particular positive case gave us pause because we can't find exactly if this person had a travel history. And when I say we can't find, we found out that he hasn't been traveling, and if there's any possibility he had, that's still an investigation. But the probability that he traveled is very, very low from our initial investigation. Remember, we've only had a few hours. But we feel like this particular case is different, and that's why we had to, at this time, come forth. And the county executive was absolutely correct. This is a shift in how we start to approach things. And I think that's why when I was talking, we have to do this together. This isn't a health department dictating. This is not what the health department is doing for you all. This is what we're doing together. This is a social responsibility. It's part of my mission. And that third leg of my mission says I have to make sure that everybody in this county takes responsibility for prevention, disease, and accidents, anything that could cause them to be unhealthy. So I'm going to be pushing to make sure that we do that. So I thank you.